Hi there, my name is Dr. Victoria Maniele and I am a member of the Icmfel International Christian Medical Fellowship, and today I'm here to talk to you about tuberculosis. This month, awareness disease is tuberculosis, so here joined by myself and my colleagues, we are going to talk about tuberculosis. We're going to break it down to the symptoms, the types, the causes, how to diagnose, how to treat, the epidemiology, and etc. So stay tuned. So I'm going to first of all be here to bring you the overview of tuberculosis. So, what is tuberculosis, or aka TB for short? So TB is a bacterial infection spread through inhaling tiny droplets from the coughs or sneeze of somebody who is infected with an active tuberculosis. Later on, my colleagues will explain more further about active and latent. So TB, as we all know, I just said about coughing and sneezing, we all know generally that it affects the lungs. But it can actually also affect other parts of the body, such as the brain, the kidneys, the spine, and etc. So, this tuberculosis, what actually causes tuberculosis? So, as I said, it's caused by a bacteria that is called Mycobacterium tuberculosis, MTB for short. So, it's spread when an active tuberculosis patient, someone who has active TB disease in their lungs, coughs or sneezes, like I said, and someone else inhales the expelled droplets which contain the TB bacteria. So to be more specific, you have to actually sneeze or cough out the TB bacteria as particles in your droplets for somebody else to inhale it and then become infected. And again, a person who has active TB is able to spread the disease. So as you see in this diagram here, it's a little bit more of an explanatory diagram. So later on, my colleagues are going to talk about the symptoms, the epidemiology, the prevalence, how to diagnose it, how to treat it, and etc. But I want to just point out that although TB is spread in a similar way to the cold or the flu, you might be wondering, is it contagious? Well, you have to spend enough time with a person who is infected. You have to be in close contact with them to catch the infection yourself. For example, TB can be spread between family members who live in the same house, they are always spending time together, they are together for long times or periods of hours. So in order for you to get infected, you have to be actually sitting next to a person who is infected with it and have them cough or sneeze. Maybe in a bus, in a train, in public spaces, or in areas where TB is in high prevalence. So yeah, so thank you for listening, and I hope you stay tuned to the end of the video.
Hello, my name is Dr. Augustine K. Bala, and I'm joining the team at Icmfel today to create awareness this month about tuberculosis, in short, TB. And so I'm going to be talking about the epidemiology of TB. In short, is giving the prevalence, the statistics about the disease, right? And so, according to the World Health Organization, the WHO, you have about 1.7 billion people that have been infected with tuberculosis. That's like 22% of the world population. And from 2003, there has been an increase in the prevalence of tuberculosis up to this year. But I'm gonna give the recent statistics from WHO. So according to WHO fact sheets from their website, in 2021, you have 10.6 billion people that fell ill with tuberculosis, TB, worldwide. Okay, and out of that 10.6, we have 6 million that were men, and 3.4 million were women, and 1.2 million were children. And so TB is present in all countries and all ages, men, women, children, all groups, and at all ages vulnerable to TB, right? So it's a very important infectious disease that needs to to be looked at, awareness needs to be created about as well. Also, just 2021 alone, you have 1.6 million people that die from TB. So out of the 10.6 million people that fell ill, 1.6 million die of tuberculosis, of TB. Yeah. And out of that 1.6 million people that died, 187,000 were people who were living with HIV/AIDS. And so these are a very significant number. And to just note the important thing when it comes to why this awareness, especially this month of March 25th, is World TB Day. And so we're joining health practitioners around the world from Icmfel to create awareness for TB. So, but to just mention this as I end this section about the epidemiology, with the exception of COVID that killed millions of people recently, so TB is the second leading infectious killer, second to COVID. So apart from COVID, the next leading infectious disease killer is tuberculosis. Even though it's the world 13th leading cause of death, but when we come to the infectious disease category, it's the second next to COVID. And so it's very important that we create awareness for it. We hope that our awareness video this month is going to be useful to you, and you're going to pay attention to that as we help our world. God bless you.
And welcome to today's edition. My name is Dr. Alan of the International Christian Medical Fellowship. It's World TB Awareness Month, and we at International Christian Medical Fellowship are also creating awareness to end this deadly but curable disease. TB is deadly but curable, and that is why we need to educate ourselves to get the treatment for this disease. As we've already learned from my previous colleagues, TB or tuberculosis is spread from person to person through microscopic droplets released in the air, and is spread when the person coughs, the infected person coughs or sneezes or even sings, and it's caused by the bacterium, Mycobacterium tuberculosis. TB usually affects the lungs and can also affect the other parts of the body. TB can be primary, whereby the person is being exposed to the bacteria for the first time, or can be secondary, whereby the person has already been exposed to the bacteria. And about 1/3 of the world population is said to have TB, but fortunately it's only about 5% that will progress to the active phase. The remaining will just be in their latent phase or dormant stage, where they will not show any symptoms or cannot even spread the disease. And once the bacteria enters the body, they go and settle in the lungs, and the immune system, the macrophages, would ingest them in a way to suppress or keep them under control, and they can remain dormant throughout a person's life, and that is what we call the latent phase. They are dormant, and usually the patient will not present with symptoms and cannot transmit the disease. However, if the immune system is suppressed or compromised, such as people with HIV or even in malnutrition, extremes of ages or aging, the aged especially, the body can get a reactivation of the bacteria, and that is where they start seeing symptoms and can also spread the disease. So it's advisable that once you start seeing symptoms, you should visit your nearest health facility for treatment. You won't want to spread the disease to, if the person is very contagious, the person can spread the disease to other people nearby. And so we advise that when you start seeing symptoms, you visit the nearest health facility for appropriate treatment, because TB is curable and you wouldn't want to spread it to the other person, because at that moment you are very contagious and you can easily spread it to people around you. TB is treatable. Get tested today. Yes, we can end TB. Thank you very much.
Hello, my name is D. Naomi Flomo, and I will be talking about the symptoms and signs associated with tuberculosis. Patients with latent or inactive tuberculosis do not show any symptoms. They might, however, test positive for a skin reaction or blood test. Patients with active tuberculosis can present any of the following symptoms: bad cough that lasts longer than 2 weeks, chest pain, pain with breathing or coughing, coughing up blood, weakness or drowsiness, loss of appetite, loss of weight, chills, fever, and sweat during the night.
Hi, welcome everyone. Dr. Bala here again. In this section, joining my colleagues, I'm going to be talking about the diagnosis of tuberculosis, microbacterial tuberculosis or TB. And I'm going to be very brief. And so, first of all, there are tests for screening and there are confirmatory tests that is done. So I'm going to start with the screening test. So usually for screening purpose, whether for people who are exposed or who are at higher risk of TB, so it's better to do a screening test. So for the screening test, I'm going to mention two major common one that is used to diagnose tuberculosis. And so the first one is the Martor tuberculin skin test. So it's a skin test. Some of you, if you have ever been exposed to TB in certain category, you have been able to do the skin test. So the skin test is actually done with the PBD, what we call the PBD, the purified protein derivative. It's done to be able to detect whether TB is positive or negative. The next step, it is actually detected. The skin test can detect TB if you are exposed to infection or if you get infected in 2 to 10 weeks. Yes. And the next test that is used for screening is called the IGRA, that is the interferon gamma release assay test. Is a blood test that is also done for screening. And so the two different tests that is done for screening is the skin test done with the PBD, and then the IGRA, the in vitro blood tests. So these two tests are the tests done for screening to diagnose tuberculosis. But if the skin test or the IGRA is positive, the actually confirmatory test as well that is done. So let's say people or somebody whose skin test is positive, or somebody who having active scrotums and they're coughing and they think they're exposed to TB, and it's good. The confirmatory tests that are done, one is the sputum smell. So once the person is producing cough, sputums, usually you can be able to do other confirmatory tests. So one of the confirmatory tests is if you're able to secure sputums, a product from the person cough, then you can do a sputum smell, where you can be able to do an AFB, that is an acid fast exhaling test, to also be able to confirm the diagnosis of TB. The next test that can be done is also the nucleic acid amplification test. That is a PCR laboratory test that can be done. So the AFD, the nucleic acid amplification, the PCR, these are all laboratory tests that can be done. And then the third one, apart from the PCR, the AFB, the third one is the culture. So you can do culture, but the culture usually take longer times for the result to come out. It's like 3 to 8 weeks if you do the culture. But the AFB and the nuclear acid amplifications test, that's the PCR, these are much faster laboratory tests compared to the culture. So the culture could be either the sputum or they could do blood culture as well. But that take longer, especially the sputum culture take the 3 to 8 weeks for the results to come out. So for the sputums and blood laboratory test, you can do a PCR, that is the nuclear acid amplification. You could do a AFB, the acid fast bacillary test. You can do a culture. So it's a 3 laboratory test. Apart from that, you can also do imaging, right? So you do a chest X-ray, that's the lower in situation where you don't have advanced facility. But preferably, you can do a CT scan, chest of the chest, to be able to confirm the diagnosis. Usually on the scan, you'll be able to see cavities or infiltrations. These are some of the findings that can be very clear indications of TB imaging. Yeah, so I was talking about screening. People that are as a special category of people that need screening as well. For example, pregnant women. Pregnant women should be screened for tuberculosis. You should either do the skin test or you do the IgRA test for them. And also children, because it's possible where you can have congenital TB. So children should be screened, especially infants. They should be screened for tuberculosis as well. And the third group of special people that special attention you should pay to now is people with HIV and AIDS. And so, like talking about the epidemiology in 2021, out of the 1.6 million people that died from tuberculosis, 187,000 were actually people with HIV and AIDS. So every HIV and AIDS patient should be, or somebody who is diagnosed of HIV and AIDS should be able to do a tuberculosis test as well. And if you have tuberculosis, it's good as well to be screened for HIV. So yes, so pregnant women, infants, little children, and people with HIV and AIDS should be screened for tuberculosis. That's very, very, very important. And quickly, the test that is done for screening is the skin test and then the IgRA. And also for confirmation, laboratory tests, you can do the PCR, the AFB, and sputum or blood culture. And then imaging, you can chest X-ray and CT scan. The CT scan, you could go on in the much more advanced facility, or if you have the facility, you can go on doing a PET or the specs. Yeah, so these are the basic workup that is actually done for the diagnosis of TB. Thank you.
Hello there, good morning, good evening, wherever you are, depending on what time you're watching this video. So the people who came before me talked about what is tuberculosis, how do we diagnose it, and me, I'm Dr. Faustin Mamburu, by the way, so I'm going to talk about the treatment. How do we treat tuberculosis? So the first thing we have to put in mind when we think about tuberculosis is we need isolation. First thing first, those patients have their own ward, especially those who are seriously sick. After that, there is report. We have most countries like in China, in the US, or even in Congo, like you need to report the case to the local CDC. And after you report it, most of the treatment are free depending on the country, but I could say that 90% of the country out there, the treatment for tuberculosis are free because, it's a public health issue, so we need to treat those disease as soon as possible. When somebody is unfortunate enough to get that, we have to treat it. So first thing first is we have 2 guidelines according to the CDC, Some people go for the first guideline, but some other people go for the second guideline. The first guideline is the 4-month therapy. We have 4 months, and the second one is 6 to 9 month therapy. you would say, oh yeah, maybe the 4-month therapy is better than the 6-month. Well, at this point, those two are okay. So it depends on which country you are or what you choose, then that's fine. The first regimen is we have 4-month therapy, and as the name also say, we give the treatment for 4 months, about 17 weeks to be exact. And then the treatment we have rifampicin is an antibiotic, and then we also use together with the moxifloxacin, and then we add isoniazid and pyrazamide. So when you give isoniazid, you have to give vitamin B6 because those patients might end up having side effect of vitamin B6 deficiency. And the second type of treatment is this 6 to 9 month therapy, where we give an active therapy for 2 months and then the passive for 4 to 6 months. So depending on where you are, the country will take care of the person who's sick, and after they take care of the person will get better. So those are the treatment of active tuberculosis, which are not drug resistant. For drug resistant tuberculosis, we have another type of treatment, and for inactive tuberculosis, we also have another type. So that's all for today. Thank you so much, and may God bless you. Thank you. Bye-bye.